So whiteheads, is this a topic you're interested? Why you get whiteheads, where they're coming from, how you treat them or how to avoid them, and this is something you are interested in, you should stick with me. So my name is Dr. Liv Kraemer. Who doesn't know me? I'm a board-certified dermatologist with my clinic in Zurich, Switzerland. So what are whiteheads? These are the small little white things you would love to pop. Please don't. Right? Because nothing is worse if you pop them and it's more bacteria getting in, they're getting more inflamed, and then the worst thing ever, what could happen is a scar. So let me explain. So this is what I do with my patients in my office. So let's draw. I like drawing because it's easier to understand. So I always tell my patients, think the first layer of your skin is like a cobblestone wall. And if you saw my video about blackheads, it goes in the same direction because the next stage of a blackhead, it's whitehead. So, okay, let's draw. The first layer, as I said, is like a cobblestone wall. Really, I will draw this kind of cobblestone wall. A couple of layers, one over the others, the mortar between the bricks between the mortar. I hope you see it, otherwise say it. Joking. So you see the cobblestone wall. This is the top part, this is the lower part, so this is on top, everything as well. Sealed. So in the end, nothing's supposed to come in and nothing's supposed to come out. A nice cobblestone layer. It would be lovely if it would be like this, but just something can go inside if something is disrupting this cobblestone layer. So in this case is during your hair, not the hair on your head, but you have hair all over your face, really all over, and you need them. You just have a couple of areas where you don't have hairs, lips, palms, but this is a different story and a different kind of video blog. Okay, so you have this disruption with the hair. So this is the hair you almost don't see, and this is the hair bulk. So now you have a gap suddenly, right? Like a gap between this cobblestone and this hair. And this gap becomes wider with hormonal changes and stress. So guess why you get pimples just before your huge date, or before you get your mens as a girl, or actually if you're stopping your acne control pill, or changing the acne control pill, or actually entering puberty where the hormones are kind of getting crazy. Okay, so then second thing is all the bacterials on top. These bacterials here, they would love to come in, but here everything is sealed, so they can't. But if the gap opens up with hormonal changes, exactly what's happening, all the dead bacteria can go inside in these sebaceous glands down there. And exactly, if you're entering puberty, if your hormones are crazy, your sebaceous glands are overproducing. So what they're doing, they're producing a lot of food for these little guys, and they love this, right? So actually they're growing inside, they're loving this. And suddenly there's not enough space down there, so they get stuck, which we call a blackhead. Watch my video about blackheads. And if it's not enough space and they're actually going all out, we call it whitehead, because all the dead skin's kind of covering this up. We call it hyperkeratosis, a kind of this sugar head on top with all the garbage underneath. Right? And if it's got more inflamed, we call it cysts and papules. So different kind of stages of acne, much more party people down there will cause actually the next kind of stages. But let's make it easier and not too confusing for you, right? So bacterial is also a main cause, the acne, bacterium propionis, the sebaceous glands down there who are kind of really active, so a lot of food, and of course these dead skin cells. So this is exactly where we have to attack. And this is what we dermatologists are doing, and this is what you could do also in a small kind of steps at home with some of the home treatments. And the first one is, of course, reducing the amount of bacterials on top. Okay, so reducing bacterials could be done with ingredients the killers, the benzoyl peroxide, which you can actually get in drugstores. They differ in kind of things like washing. So this ingredients is in washing ingredients. It could be in gels, it could be in lotions, it could be in serums. So mostly use it as a washing detergent. I'm not a fan about benzoyl peroxide because it stains your clothes and sometimes makes your skin a little bit drier. So I'm not a fan about it, but if you don't have a dermatologist next to you, it's probably the first step you should try. Another ingredients to call bacterials are of course antibiotics, could be a gel, could be a lotion, but this is something what we dermatologists have described as soon as we saw your skin. Next thing what you could do, except minimizing these bacterials on top, is trying to remove these dead skin cells, which is crucial because everything what's trapped is enclosed. You have to remove the dead skin cells, the sugar head, that all the garbage comes out. And these are ingredients like alpha hydroxy acids and beta hydroxy acids. I will give you some examples down there. So beta hydroxy acids, it's biochemistry, right? So you know as the ingredient salicylic acid. Salicylic acid is a beta hydroxy acid and removes dead skin cells. This is what you feel dryish, right? And a percentage of 2%, it's sometimes you feel really like kind of a scaling, and most of you unfortunately do the kind of mistake covering it with fatty creams, which is counterproductive. Watch my video about which kind of creams to use. So the difference about serum or cream for acne, and this gives actually the answer never to use fatty creams or oils. We come to the topic about facial oils because everything, it doesn't matter how great ingredients are in facial oils, they are oils, so they're covering the dead skin cells like in a party tent, so they can grow underneath. So try to avoid everything what is fatty, everything what we call comedogenic, everything what is fat. Try, even there's oil free, if it's kind of a fatty, greasy consistency, hands off. Okay, so alpha hydroxy acids are also fantastic to remove the dead skin cell from on top. Another one, which is sometimes we dermatologists need to prescribe, it could be as creams or tablets, these are vitamin A's, retinoids, which are pushing all the garbage from underneath out, and this is why you feel dry. This is why all these videos out there, all the YouTube videos are like, oh, how bad it is to use this tablet we dermatologists described. Guys, fears just happens because of non-knowledge, right? If you know, you're not afraid. So if something is dry, guess why? Because everything comes off. You want to get things from underneath coming out. And this is what you feel is dryish. But please, please sit down with your dermatologist and let him or her decide which wheels you can move in order to really handle acne and really to handle like nodules, papules, cysts, whiteheads, or even blackheads. But as I said, there are a couple of things you already can try to avoid and try to minimize bacteria on top. Try to keep the turnover. Don't scrub because the dead skin cells will never go with rubbing or scrubbing. It will make it even worse. I got some question about the brushes. There will be another video coming out. So I hope it actually gave you some answers. And yeah, one is actually what I also got asked is like clay mask or mask. I mean, everything, this is just topical. It's just reducing some of the kind of oily things on top. It comes down, it helps, but just transitionally and not long term. So I hope you liked it. I hope I gave you a little bit light upon the tunnel. Give me some questions, give me a like, subscribe to my YouTube channel and stick on my YouTube channel because there will be some more videos coming up and answering hopefully a lot of questions. Okay, wish you all the best. and give you some, I will definitely give you some suggestions down there. So scroll down, subscribe to my YouTube channel, subscribe to my Instagram account, Dr. Liv. I give some tips there as well. I hope to see you soon.